Okay, welcome to Suggestions and Considerations when moving a body part of a patient or even the patient themselves during transfers. One thing that's really important is that we have what's called an ongoing assessment of the patient, because patients change in regards to their cognitive or their level of consciousness when they're in our care. And so we want to try to be very in tune on what's going on with that patient. So as we're interviewing or as we're sort of assessing the patient per se in a very preliminary way, we want to start to extract information from the patient. So one of the ways you can do that is you can ask the patient how they arrived into the hospital. And if they came by themselves, then you start to have an idea if perhaps a loved one or a friend or family member escorted the patient. And that will all give you very good connections with that patient, because what it demonstrates is you're actively listening and you're trying to determine how to best approach this particular exam. All right. We also want to do what's called an assessment on the mechanism of the injury. So, if the patient was injured from something that came from behind them, or if something that came over top of them, or what was the clinical history? Were they doing an activity? Were they in a motor vehicle accident? Things such as that. We are also going to consider in ensuring that when validating that we x-ray the correct body part or what's been ordered. And so where's the primary area of interest? So what tends to happen is sometimes the more serious injury is subtle, and we tend to sort of, what catches our attention is the area that has all the blood and scrapes and that sort of thing. But the real perhaps area of interest, or primary area of interest, may be much more subtle and not necessarily as obvious. So we want to interview the patient and ask them, get their information about where it hurts and that sort of thing. We also need to determine how mobile they are and what their involvement is when it comes to participating in the exam. Okay, we cannot make assumptions that because they were able to walk in, that now perhaps, or be escorted in a wheelchair, that perhaps they can do all of the things one would think. Now maybe they're on pain medication, etc., like that. And what's their level of comprehension? How are they responding to your questions? How are they behaving? Some of those key elements, because again, when someone's in shock, they can present quite differently than who they really are. Okay, so those are some of the things to take into consideration. Make sure you explain who you are, what your role is, and what you are going to be doing. When we talk about what we're going to be doing, we're also going to expand on that, and we're going to ensure that as we are speaking with the patient, and this is ongoing, so we don't it's fluid is what I mean. So as we're bringing the patient in and clarifying their name and date of birth, etc., like that, we are giving them information about ourselves, such as who we are and what we're responsible for. You're also going to provide what I would consider it's important, but it's a relevant description of what you are going to do. Okay, and relevant meaning, we can sometimes give too much information or not enough information, so we need to sort of really kind of select the key points of the exam itself for what the patient would need to know. We also want to make sure that the patient understands what is expected from them. So something so simple as, when I take the picture, it's really important that you don't move. All right? Or when I take the picture, I'm going to ask you to take a really big breath in and hold your breath. And that's when, again, too, as we're continuously assessing and really kind of evaluating the patient, we can understand if, they might not be able to take a big breath in, or how are we going to adapt or approach that differently. We're also going to let the patient know what they can expect from us. Okay, we're going to verbalize that, I'm going to try to make this as comfortable as possible. We're going to make sure that we take our time. We're going to make sure that we get the best pictures, and it's important that the patient really sort of understands and that time is taken to explain that to the patient. Okay, we don't want them to feel as though they're just another patient. And yes, there'll be some sites and departments where you might work in the chest room that day, and this is probably I'm not kidding you, like your 50th chest x-ray, but it's not their 50th chest x-ray. So we want to make sure that the patient feels as though we are meeting their needs at that time. Okay, we want to make sure that, of course, too, they do buy in and they agree. Okay, we are talking about that expressed consent, okay, about the patient being there. So we are looking at doing this for their benefit, all right? So when we sort of are talking to the patient, sometimes the tendency is to say, oh, could you do this for me? Inevitably, it's really it's not necessarily for you. It's a bit more for the patient in some ways, okay? When we disclose and tell the patient, this particular position may not be comfortable, okay, then what we're doing is we are building trust, okay? If we try to perhaps omit information or just sort of hope that it's not noticed or what have you, then, that trust will be broken. And the exam that really was supposed to be very easy and simple to do will take a lot longer, and it won't be as successful for either you or the patient, okay? So, ensure them we're going to keep them comfortable, ensure them we're going to take care of them, and that we're going to do the best we can here to see that they get what they need. One thing to keep in mind is our tendency sometimes is to say to the patient, oh, can I get you to sit on the table, for example? Well, if the exam or the images you have to take requires them to sit on the table, then don't give them the choice. You'll have to say, I need you please to sit down or lie on the table in order to take this exam. If possible, give them an option. So, in other words, we can say, would you like to stand over here while I get this ready, or would you? So you are going to, when possible, give them an option. But there are times where if I need to have their hand placed in this position, I need to have their hand placed in that position. So that's not really an option. The option is how we're going to get that hand into that position. Are we going to use sponges? Are we going to let the patient try by themselves? Are we going to see if the patient wants us to assist in moving the patient? Never make the assumption that the patient wants you to touch them, okay? You need to be sure that you ask permission to touch and assist the patient, okay? All right? If you're going to allow them the opportunity first to move that body part themselves, then provide them ample amount of time to do so, all right? We don't kind of want to say, I need your hand like this, but meanwhile we're grabbing the hand and we're putting in that position. Okay, so there's a time or a lag there that we want to be considerate of. Okay, one of the ways that you can look at helping the patient get into these different positions that may be uncomfortable is we'll say something like, can you put your arm like this? All right, or I'm going to need you in this position. So we can kind of give a demonstration. I'm going to have your leg like this. All right, so how do we get that arm into that position? Well, there will be many different ways of going about that, but keep in mind, we can also, too, sort of isolate the area that hurts and use the surrounding areas, such as the joint above or the joint below, to move that body part. Okay, so for example, if my elbow hurt, perhaps by using the shoulder and the wrist, we really don't have to move much of the elbow. Instead, we can just move the shoulder and the wrist to get them into that position, okay? As I mentioned just a moment ago, please allow the patient time to follow the instructions, okay? There's lots going on inside that patient's head. When someone's injured, we all respond differently based on the circumstances, etc., like this and that. Allow that patient time. If you have time to do it over, you have time to do it right the first time. So allow that patient time to follow those instructions, to give this expressed consent, and to really kind of have a significant role in their own care and for the success of this exam. If the patient is, for instance, already in a particular exam, so sometimes patients come in and let's say they're holding their elbow by their side. Well, you know what? The protocol states we're going to need a projection with that elbow by their side. So let's start with the position that patient is already in. Okay, so we're not going to necessarily follow, because the protocol says this. Nope. If we're going to do 3 images and that patient is already in one of the positions, let's do it just like that. Okay. Let's walk the patient through what's going to happen next. Okay. So it's an ongoing conversation. All right. So from here, from there, this is what we're going to do. We're going to estimate how long it's going to take. All right, we're going to follow up with an explanation as to what's going to happen afterwards. So if the patient comes in through Emerge, then we're going to say, okay, so I bring you back over to Emerge, and from Emerge, the physician's going to see you from there, and they're going to give you the results. Okay, there is an exception, and that those are Alzheimer's patients, because they're not necessarily able to process what's going on in that sort of sequence. All right, we need those patients to buy into what we are going to do here. All right, and so that trust and that transparency is really important. Okay, if we have a patient who is struggling, there are modifications that can be made. Okay, there are different ways we can go about obtaining these different optimal images and what have you. And experience will assist with that, and as well as to many different technologists will be able to really expand on what they do and the different sort of tips and tricks that they use. Pardon me. So just something to kind of keep in mind. There is so much, and I appreciate that. But as I would have to say, when you are making observations out in the hospital and you're seeing how all the different technologists are approaching particular situations, really absorb that. Really sort of just take it all in, and there will be so many technologists that can provide you with so many different ways of how to approach a certain patient. So please think about, if you were the patient and you had a sore body part and you were asked to be, that body part to be in that position, what would you appreciate? Okay? All right. Just something to keep in mind. Thank you.